Here's T-Bone and Heather on Star 98.3 and 97.7 The Bay.
Well, good morning, all. Welcome to the show.
Good morning.
Joining us on the phone lines this morning, trying to push all the buttons correctly, we have Dr. Hawit. Good morning, sir. How are you?
Great. Good morning.
Hey, good morning, doctor. So glad to have you on. Listen, you're a dermatologist. May is Skin Cancer Awareness Month. There is so much to talk about. Okay, as a small child, Dr. Hawit, I was very fair-skinned and red-haired, and zinc oxide was the mode of sunscreen my mother would put me on when we would go for a week at the beach. And
That's a great one.
Yeah, it is. It's a great one. But she only put it like on my nose and on my cheeks. So now I am very concerned because I would get sunburned as a kid. I mean, sunburn every year. I mean, my ears, back of my neck. So for somebody like me who is now in my very early 50s, what would you suggest somebody like I do? If I have not been to a dermatologist, but I still have concerns about skin cancer.
Yeah. Well, the first thing is to be familiar with what a skin cancer looks like.
Okay.
And specifically, you want to make sure that you know what a melanoma looks like.
So what do they look like?
We have this an acronym called ABCDE of melanoma. So, A stands for asymmetry. One half of the mole doesn't look like the other. B stands for border. So the border is scalloped on a melanoma, like the coast of Maine or the coast of California. It's not smooth like a ball.
Okay.
C stands for color. So there's more than one color. There's usually a little bit of charcoal black, some light brown, tan, maybe a little pink. D stands for diameter, which is the size wider than a pencil head eraser. Although we see melanomas often that are less than.
We're just looking at moles.
We're just looking at as you speak. I'm just going through. Okay, all right.
Yeah. And then, that's C. And then E is really the most important one, in my opinion. That stands for evolving.
Is it changing? Is it growing? Is it getting bigger,
Exactly.
changing colors?
Yes. Any mole that's changing, that's itching, that's bleeding, that's growing, anything along those A, B, C, D parameters is very important to be mindful of and say, hey, you know what? This mole is changing. It's, it's not acting funny. I like to think of it like, ducks in a pond. So if you have 10 ducks in a pond, all of them are, kind of gently quacking, but one of them starts to say moo. The one that's mooing is obviously not.
That duck needs to be shot.
Exactly.
I need to cut that duck out.
So, okay, doctor, look, I am just like most folks. I go into the pharmacy, department store, whatever I'm doing, to pick up some sunscreen. I don't know. It all looks the same. They all say they're the best. What am I looking for?
What do you suggest?
So, anything that you feel comfortable using on your skin that is over an SPF of 30.
Over 30.
Over 30. 30 is the number to beat. I personally dislike the sprays. There was recently, I think about a year or two ago, the FDA was looking at absorption of the sprays into your bloodstream. So I'm not a big fan of the sprays.
Oh, I didn't know that.
Okay.
Nothing. I personally, like you were saying, Heather, I like the zinc. I like the micronized mineral-based things that have zinc in them. And you want to make sure that your sunblock is fresh. You don't want your sunblock from last year. There is an expiration date on sunblock.
There is an expiration date, yeah. I check it every year.
I'm not good at I usually just drag it out of the bottom of my tackle box from 5 years ago.
Right.
Exactly.
That's dangerous. And, a lot of people leave it in their boat.
It is.
Leave it in their cars.
Right, and it gets hot.
It gets hot, and so, actually it becomes deactivated. So it's not as effective if you, have it get hot. And I mean, it's like I said, it's better than nothing, but you want to get some fresh sunblock from the pharmacy.
Hey, listen,
online.
Dr. Hawit, men, we can agree, are the worst. When it comes to going to see the doctor, taking care of their health, men are out in it all the time. Roofers, watermen. Yeah. I mean, men are out in the sunshine. And, I don't know if they're using sunblock or not. Would you encourage men, just as women, to get in to see somebody, especially if they see something weird on their ear or on their shoulder?
Yeah, absolutely. The easiest place is at the primary care doctor if they're going for their physical, their blood pressure, just, hey, what do you think of this? And,
Right.
Obviously see a dermatologist. For men who are outside, the thing that I really encourage them is if you're not going to put on the sunblock, at least put on a shirt that is, tightly knit, and put on a hat. And, my son loves baseball, and I love, enjoy baseball. The Nats are not doing as well as I had hoped.
No, they're not.
But, the key thing is to protect your neck. So baseball caps are not great at protecting your neck. So if you're going to be out on your boat, if you're going to be out cutting the grass, baseball caps are not the way to go. If you can, just kind of wear a wide-brimmed hat. You look a little funny at first, but
You're protecting
or a
yourself.
cowboy hat or an Amish hat or
Sure.
any kind of a wide-brimmed hat that will
Right.
protect your ears and your neck.
Hey, Doc, can you cure a melanoma?
Absolutely. When you catch a melanoma in the earliest stages, it is very, very curable with just a simple local excision. And then we remove that site and put it in the jar and confirm that the margins are clear. When it's advanced, when it's gone down into the dermis, then it becomes much more difficult. So that's why early detection is key. Don't kind of wait on a bleeding mole, things like that.
So what? Kids. They're out.
Kids.
They're out all day.
Also,
it's
we
summertime.
agree they are the worst.
Yeah. What? I mean, are they at a big risk for this, or is it something to have? They get a lot of sunburn when they're a kid, and then later they can get it. But I mean, is this something that kids can get?
Yeah. What would you suggest for parents to protect their kids?
Okay, that's a good question. So the first thing is with infants, a big mistake people make is they, before the age of 6 months, you should not use the heavy cream sunblocks, just because they can't sweat. So you don't want to slather a 6-month-old or younger with sunblock.
Babies can't sweat?
Well, I know they can sweat, but the sunblock can.
Not if they're covered in cream, they
so they
can't.
become hypothermic.
Oh,
Yeah.
I gotcha. That's
So-
I didn't even realize that. Excellent.
Yes. So you want to make sure that, you want to, number one, obviously, you want to not take them out in the middle of the day to the beach, if it's at all possible. Number two, you want to use more physical blockers like umbrellas and clothing and hats and things like that when they're very young. But, for children, my kids play soccer, baseball, and all these different things. Just try, it does matter. Before the age of 20, we know that sunburns really increase your risk of melanoma if you have multiple skin burns by 80%. So I think of it like popcorn kernels in a microwave. The more time that you have on that microwave, the more energy is getting into those popcorn kernels, and they start popping. And so when you're young, it seems that the time is exponential. So you want to make sure that when they're young, you try your best to, at least put on a hat, put on a little bit of zinc like your mom used on you.
Right.
And really, if they can, just kind of wear those UPF shirts. I'm a big fan. I don't know if you guys have heard of these ultraviolet protective factors.
Yeah.
UPF.
Yeah.
They're fantastic. I mean, you can buy them. They're not as expensive as they were just about 5 or 10 years ago. More people are making them, and just kind of put on the shirt before you go out onto the beach, and the hat, and the zinc.
Hey, Doc, what do you say about people who, like old school people who say, "Hey, I'm going to go out and I'm just going to get a base tan. That'll help me out. I'm going to get
a nice base tan.
A nice base tan." What I mean is that the way of the dodo? Should we not get a base tan anymore?
It is the way of the dodo.
Okay.
It is very, very unwise. I mean, we know that people who use tanning beds have a much higher risk of getting a melanoma. If you go out and you go to the tanning bed and you get a tan, a base tan, that gives you an SPF of maybe like 1. I need to check that.
Oh,
make sure,
really?
But
Okay.
1.5 or 2. So you can spend maybe a little bit more time in the sun before you get sunburned, at the expense of dramatically increasing your risk of melanoma. So it is the way of the dodo bird. It is it's a foolish thing to get a base tan. It's much better to prevent it in the first place. A dark tan, a chronically dark tan, is almost as bad as repeated sunburns. So it's,
but what if you look awesome?
Yeah, what if you look really, really good?
They have the spray-on tans. Those are great.
Do you like spray-on tans?
I mean, they're better than the real.
Better than the real
tans. They have they have those available. I think they have moisturizers that have tints in them.
Yeah.
So you can kind of wear a tinted moisturizer. They have tinted sunblocks too. I think those are great.
How often does somebody realistically look? Here's how I work, and I'm not saying this is right. This is just how I work. I don't go to the doctor until something hurts, and sometimes
That's
not.
true.
Sometimes not even then. So how often do I need to be
Once
doing
a
this?
year, right?
Yeah, sure. I mean, well, more than that, we encourage you to look at your skin, monthly. You should have a handheld mirror and then a wall mirror. And, if you have a partner, they can help check your back and the back of your legs. So you should be looking at your skin often. That's, I think, the key is to be self-aware. Because if you're self-aware, if you're familiar with your skin, if you know all of your moles, then one of them starts to say oink, then you say,
Yeah.
oh, you know what, well, that's sort of my trigger to say something is not right with that.
Hey, Dr. Hawit, is melanoma, is it like breast cancer? Is it could be genetic? Like if my mom has it, which she has had breast cancer in the past, or not breast cancer, but melanoma, is that something that, kids need to be aware of? Or is it just who knows who gets it? It could be because you were, burned as a kid or whatever. Or is there a genetic factor there?
Oh, absolutely. I mean, there is a genetic, so anybody can get a melanoma. Any kind of ethnicity, any color of skin can get melanoma. But we do know that genetically that there are specific genes, and we actually know the names of these genes, that when they're faulty, really increase your risk of developing a melanoma.
Oh, okay.
Even at an early age. The majority of melanomas happen in older adults, in men, and before the age of 50, the majority happen in women. So we know anybody who has a family history of melanoma has an increased risk. Anybody who's got, red or blonde hair, blue or green eyes has an increased risk. A history of tanning beds, a history of other cancers like breast or colorectal cancer increases it. If you have like 50 or more moles, large, unusual moles, that increases. If some people are born with these large congenital moles, we call them, they have an increased risk.
We're a mole family. Yeah, we have a mole family.
So then, what's interesting, there's a study that found that if you have more than a dozen moles on your arms, that really increases your risk of melanoma.
I mean,
as well.
I'm red hair, I'm green eyes, I'm fair skinned, and we're mole. We're mole people. I have more than 12 moles on my arm, I think.
Yeah, so you have an
I have
increased
to
risk.
get tested, every single year.
That
or
whole
more.
genetics thing, that's really the whole future of medicine, don't you think? Where it seems like everything is coming down to
You can get a genetic test and you can...
genes, and nothing's 100%, but if you have these markers and these genes, you're more likely to be, these are the diseases you're going to have to watch out for.
Yes, absolutely.
I'm pretty much a doctor.
Not even close. Hey, Dr. Hawit, Calvert Health Medical Center, thank you so much for taking time with us this morning. May is Skin Cancer Awareness Month. It can sneak up on you. Pay attention. And seriously, thank you so much for talking to us this morning on Medical Monday. We appreciate it.
You're welcome. Thank you for having me.
All right.
Take care, bud.
you.
You got